All right, welcome everybody to another Southern Ohio Prepping live stream. We have with us tonight the good Dr. Bones and Nurse Amy. We're going to ask a couple questions, then we'll open up the chat for you guys to ask questions as well. Gil's going to try and catch any questions. Please make sure you throw your questions up in caps so one of us catches them.
Now, can we write too?
If you have a second device, you'll be able to.
Okay,
unfortunately, they haven't opened that up to in StreamYards yet for panelists to say much. Unfortunately.
Okay, no problem. Now she has another computer she's going to try to log in so that she can also talk or chat in the chat room.
I'll try.
Okay.
All right. We got 9 people here.
I'm ready.
All right. First question: what got you guys into the prepping mindset?
Well, I'll tell you, it probably goes all the way back to Hurricane Katrina. We looked at what happened to Hurricane Katrina, and you may think that the government really dropped the ball with regards to our medical response. But, hundreds of medical personnel were on their way over. They were converging upon New Orleans even before the storm was completely through. So what happened that so many people died and so many people couldn't get to medical help? It was very simple. It was flooding. There are things in natural disasters and man-made disasters that just plain old stop the ambulance from heading in your direction. And when that happens, you better have somebody in the family who's medically prepared, who has a fund of knowledge regarding medical issues, first aid issues especially, somebody who has some supplies that would be able to help if somebody got injured or ill. And basically you just need to have the equipment and the knowledge, and you have to have the training. And so our mission is essentially to put a medically prepared person in every family. That is basically, from until the end of my days, I'm going to be trying to put together an army of medics held in reserve,
right?
Held in reserve for when they are needed. And so I would think that also another thing would be the swine flu epidemic.
Yes.
Right. In
that was
2009,
a big thing, yeah.
That also was a big thing then. At that time, we found that there was unavailability of the antiviral flu drug, Tamiflu,
right?
Because there was just too many people that were in demand for it.
Well, plus the government was hoarding it,
right?
And they weren't producing enough,
right? In Fukushima, the potassium iodide, which is the stuff that you take to prevent thyroid cancer down the road, that was completely out. So, I mean, it just makes sense to stockpile medication, stockpile medical equipment, and gain a fund of knowledge and gain some training so that you could possibly save a life somewhere down the road.
Okay, next question. It's a doozy.
Uh-huh.
If you could only stock 4 of the fish mocks, the bird stuff, which 4 would you choose? For those who are on a limited budget, you can actually, they want to stock it, but they can only afford, say, $100 every few months.
All right. Well, I would say that fish mocks itself is the main one. The original one that I started writing about all those years ago was fish mocks. I found over antibiotics that met my criteria. The criteria had to be only available in human dosages, only one ingredient, the antibiotic itself, nothing there that makes your fins shine, your scales brighter, and prescription. And they have to be identical in appearance, including the identification numbers to an antibiotic that's made by a human pharmaceutical company. That's the way I know they come from human batches and they're just separated out and put in different bottles. And my choices would be fish mocks for people who are not allergic to penicillin, amoxicillin. Fish mocks is amoxicillin. It's very commonly used for infected wounds and a number of upper respiratory and kinds of infections. So that would be very useful. I think that doxycycline would be a good second choice. That of the diseases, or the bacteria rather, that cause diarrheal type diseases. People die of dehydration due to contaminated food and water. And believe me, that's going to be one of the main reasons that there will be avoidable deaths in times of trouble is having contaminated food and water cause some kind of diarrheal disease. I mean, so dehydrated, you die. And that, we just look back at history at the Civil War, where more soldiers died of dehydration due to these kinds of intestinal, died from bullets or shrapnel. I would pick that. Bird zithro is very. Oh, by the way, doxycycline is a bird biotic. It's basically Z-Pak is one of the most popular.
You need to lift this up. I just spilled water. Just keep talking.
Okay. All right. We have a little technical difficulty here. So bird zithro would be very important. That Z-Pak, one of the most common antibiotics that is prescribed today, and that would be very good for respiratory ailments. It's good for wound infections. It's good for a lot of things. And I think metronidazole or fish zole, ZOLE, would be a good fourth one because it can handle parasitic diseases really well. And if you've been out in the backcountry like we have a lot, we love to go hiking. We're out in the backcountry and camping. Even the clearest mountain streams wind up having organisms in them. A lot of the organisms are what we call protozoa. They're kinds of germs that can cause very, very bad diarrheal disease and can make you very, very sick. You're going to wind up probably traveling through the backcountry if you're bugging out at once. So that would be a very useful antibiotic to have. It's also good for certain bladder infections, things like that. That would be useful. You can also pick a couple of other ones. I'm going to add a couple other ones, and that's fish sulfoforte. That's basically Bactrim or Septra, and that's good for bladder infections, kidney infections, things like that. And I also would pick fish CIN, that's clindamycin, also Cleocin in brand names, and Lincocin, I think, is another brand name, and that's very good for some very serious pneumonia type infections. Yep. And a number of other things. Now you can find, by the way, these antibiotics I'm talking about are good for a lot of different infections that I'm not talking about, and I do write about. Our latest book discusses tells you about each antibiotic, each bird and fish antibiotic, and what each one of them actually treats, and it tells you to recognize those diseases and how to secure them. And that's on Amazon, or you can find it on our website at store.doomandbloom.net.
If Jill, you want to mouse over to the book, sir, there you go. That's it.
Oh, thank you.
There you see a number of our books. That book all the way on the right side, the Ebola book, came out in 2014 and actually was one of Amazon's top 100 books for a period of a week or two and made the New York Times bestseller list in health. And
thankfully, Ebola's gone.
Thankfully,
from America,
yeah.
Just from America. It's raging over in Africa again.
We like to say that we cured the Ebola crisis here because as soon as we wrote the book, it hit the New York Times bestseller list for about 3 or 4 days, and then heard about Ebola ever again.
Except now, recently. Except recently.
Yeah, except
right?
recently.
Yeah.
One of our members, Lori Jean, asks, "How long are those stable?"
Aha! I'm so glad you asked that.
I know, was she planted? That's one of our favorite subjects.
She's the young lady that's very curious about the herbal remedies and stuff like that.
All right. Well, let me tell you about the shelf life of these medicines. I mean, the other thing that I'm mostly known for in my writings is sort of exposing what the truth is about expiration dates. And expiration dates were first mandated in 1979. Before then, expiration dates were purely, decision by a particular company if they felt like putting them up or not. And basically, what an expiration date is the last date that the pharmaceutical company will guarantee 100% potency of their medication. That means that if you take these medications a week or a month later, well, you're not going to grow a horn in the middle of your forehead. You're not going to grow a third eye. It is just that they are not as potent. And that's in almost every single circumstance. Now, how do I, some old retired doctor, have the gall to say that these medicines are perfectly fine to take in most cases? Well, because the Department of Defense agrees with me. They has warehouses. There are warehouses throughout the country which have collections of thousands of doses of various types of medications for natural peacetime, usually peacetime emergencies, disasters, things like that. There are about 122 drugs that basically when they became expired, out came the forklifts and out were thrown $50 million worth of drugs. Well, even the government actually realized that this was wasteful on their part. I'm no longer on the picture. I don't know if that's, is that okay?
Yeah, I've
All right.
pushed the wrong
Okay.
thing. It's
Okay.
a push
You're
button.
fine.
All right. As long as
You're still showing up here.
do you still see me?
Yes, you do.
Just go
Okay.
back.
No problem. I don't need to see myself.
Okay.
So what they did is they did a study, and the study was called the Shelf Life Extension Program. And in this study, they took 122 of the drugs most likely to be used in a natural disaster emergency. And they tested them they tested lots of expired groups of these medicines to see if they were still potent or if they had any ill effects. And they found that almost everything that was in pill or was good for 2 to 12 years after its expiration date. When I say good, I mean 100% potent. Not only 100% potent, but also generally safe to use. Now, after this, about 5 years ago, there was another study, and this study was of a room in some pharmacy in San Diego that had been walled up. They opened it up and they found a bunch of medicines, and these medicines were 28 to 40 expired. They tested these, and they actually, of the 14 active ingredients in the various medicines, 12 of them were still at 100%. Matter of fact, some of them were at 110% effective potency because the other ingredients in it, the filler and stuff, had degraded. Now, that's not what I'm not saying for you to go ahead and just take expired medicine that's 40 years expired, but I am telling you that in times of trouble, when you're down to various types of, the end of your various medications, well, to be honest, it probably was a good idea to keep some of the expired medicines that you have for times of trouble. In normal times, sure, call your doctor, get a fresh prescription. That's, everything I write about and everything I talk about assumes that some disasters occurred and there are no doctors or are no hospitals, that you yourself are now the highest medical resource left to your family. And so you need all the tools you can have in the medical woodshed, and expired medicines indeed are some of those. Now, they found that for medicines that are in pill or capsule form, but they did not find that medications in liquid form were as good in terms of staying potent over the course of time. And so it's important for you to know that things like insulin or things like antibiotic elixirs that they give to little kids, those are not going to remain potent for as long. Now, one interesting thing about liquid medicine is the EpiPen, right? That's an epinephrine injection. It's an auto injector, so to speak. Has everybody heard of EpiPens?
Yeah, I've actually got one that's like 2 years expired in my kit.
Well, there you go. Well, they did a study on EpiPens that were 3 to 4 years expired. They had a whole bunch of them. They tested them all, and they found that they were averaging about 80% potent. So even the company itself that makes EpiPens is telling you not to throw out your old EpiPens. That if you don't have anything else, to use the old EpiPens. You may need to take 2 doses rather than 1 to get the desired effect. but don't throw them out.
Which is actually pretty shocking, because everything we had heard prior to that is anything that's liquid just needs to go.
Right. And what another reason that that I'm right about this is because the U.S. government on occasion puts out what they call emergency use authorizations. During the swine flu epidemic, they ran out of Tamiflu. They made a emergency use authorization Tamiflu medications that were at up to 5 years expired. What about out-of-date antibiotics being poisonous? So, this is Wes. Wes is talking about tetracycline. Now, tetracycline is not one of the, although it is one of the drugs that's available in fish form, it's not one of my top 10 that I list in the book. Isn't that the
one they took off?
And I just want to say that
recently,
what the problem was is that there were issues with kidney failure in people that took expired tetracycline that was more than 1 year expired. Those reports, Wes, were from the 1970s. And since in the 1980s, they changed the formulation of tetracycline that's produced for human consumption. And there have not been that level of reports. As a matter of fact, I don't know of any reports since the 1980s of that kind of issue. So as far as I'm concerned, fish tetracycline, which is called fish cycline, is not going to cause kidney failure if you know, as long as you don't overdose on it, you take the appropriate dosage. But indeed, there's still stories out that people are wary of using it. To be honest, it's a first generation medication. There are a lot of bacteria that are resistant. So you could do a lot better by using one of the any of the dozen that of medications that I describe in our book, instead of storing tetracycline.
I do have one question, and I have no idea how to pronounce that word because it's a medicine I've never seen.
Okay, where am I? Let's see. EpiPens are expensive.
No, is that right on the screen there? If you look at the screen.
Right on the screen. Okay, levothyroxine. What's a proper way to store it? Any idea of a shelf life? That is not one of the medicines that was in the shelf life extension program. So I don't have specific hard scientific data about that. I would think that it would last a good long time afterwards. With regards to storing it, it's got to be stored in a dark, dry, cool place. This medicine, if you store it at 90 degrees temperature, will go not bad, but will lose its potency twice as fast as if you stored it at 50. However, you don't have to freeze it, so that it's perfectly fine to do. Now, if these things run out, thyroid, desiccated thyroid from pigs or cows, but of course, if we were in a true survival situation, you're not going to sacrifice your pigs or cows just to get the thyroid. So their thyroids, because you need them for other things. So this is it's a tough situation. You can find desiccated bovine or porcine thyroid on the internet. I don't have one that I particularly recommend, but if you look on the internet and you look for desiccated bovine or desiccated porcine thyroid, you'll find it. And what I would do in that circumstance, I would take this stuff, I would go to my doctor and I say, listen, I've got this stuff. I want to check and see what my thyroid levels are while I'm taking this stuff. Have them check and see if your thyroid levels stay within a normal range. If they sink like a stone, you know this stuff is not going to work for you. If they stay within normal range, well, then it may be an option.
Okay, a couple of questions back up here that were up higher. Ryder Dust was asking, EpiPens are expensive. Can you get them if you're not needing to use it? I want to use others just in case.
What you can do is you can get vials of, first off, there are less expensive auto injectors out. I think Click.
Yeah, but you still need a prescription.
Right.
He wants them just in case.
Right.
So obviously he doesn't have a problem, but he may want to save someone else's life.
Right. Well,
I believe this is like for a prepping supply.
Vials
it
of
would be-
epinephrine.
Right. Well, I'm going to let you do the alternate, but if you're going to go to the doctor and you're going to ask for an EpiPen prescription, you're going to have to unfortunately concoct some sort of story like, hey, I never brought this up to you, but I kind of remember, or my mom told me, or a cousin told me, or my sister told me, when I was little, I got stung by a bee and they said I had a really bad reaction. I don't remember this. Right. Well, some people do. I don't remember this. And I mean, this is totally writing, a story here. I don't remember it, but, I just don't want to take a chance. I haven't been bitten since, but, can I just have an EpiPen just in case? There's probably not a doctor out there that would refuse you, because if that story is true and they don't give you an EpiPen, they could get in trouble. So if you want to play a little game, preppers are good at, trying to get what we need to get. Not to be
us.
malicious, but to have, to save someone's life in the future. You could do that, or you could do the alternative, which you were just going to talk about.
Well, you can buy vials of epinephrine and you can actually just make individual injections. But what you're saying is actually true. There's no doctor that in his right mind that would refuse somebody who says, hi, I spent a lot of time outdoors. Remember, he refused to give them an EpiPen.
Right.
If I went to a doctor and I said, hey, I spent a lot of time outdoors, which I do, and I'm concerned about wasp stings and bee stings and things like that, can I have an EpiPen? That person that doctor, in my opinion, would be committing malpractice by not giving it.
Right.
Now,
exactly.
Now it is expensive, but I want to tell you that if you go onto their website of the MERS, I forget the name of the company that makes EpiPen. There you go. That you usually have a number of coupons that take a lot of money off of that. I know it's an expensive drug, but it is something that.
Well, it depends on your pharmacy plan too.
Right. Yeah, that's true. Yeah, if your pharmacy plan covers,
it could be a $10 copay.
Right. Exactly. Now, insulin over the counter.
Yes, it is.
Yes,
that's not the problem. It's not getting it. It's storing it. That's our problem. They're still trying to come up with freeze-dried all the insulins, and they haven't been able to figure out all the insulins freeze-dried. So they're working on it, and if we ever get that, we'll be able to have that long-term.
Yeah,
I've seen research going on.
I will tell you, I want you to look up the name of Eva, EVA Saxel, S-A-X-L. This is a woman who lived in China. She was a Jew who lived in China during World War II. And when the Japanese took over, that there was no access. She was a insulin-dependent diabetic to insulin. She actually took dogs and cats, I think, and made her own insulin thyroids. Now, the thing with her is that she had access to a full chemistry lab. And if you want to see how to make insulin, you can look at my article, The Formula for Making Insulin. You see that it involves a lot of different chemicals you've never heard of. And it's something that would be out of the range of what the average person can do. This is a woman who either was a chemist herself or, knew a chemistry professor and had access to a chemistry lab. Now, the thing with insulin, and I was on with City Prepper about this particular subject a while ago, that with insulin, you have to do your very best to ration it out so that people don't actually can last as long as possible to give time for society to restabilize. Basically, you're no longer looking for strict control of insulin, of diabetes, of sugar levels like we do today. Basically, what you're looking for is keeping people around or a little bit if you can. And that sounds absolutely crazy. You're not going to find this written anywhere other than me saying this. And one other doctor, David Miller, a good friend of mine, who is a doctor who has diabetes. But basically, with this, what you're trying to do in a survival situation is you're trying to stop these people from going. something called diabetic ketoacidosis. And so that happens around 350 or so for most people. And from my standpoint, if I can keep you at about 200 or at about 190 or something like that, you're not going to live as long as someone who doesn't have diabetes, but it may give you time for society to restabilize. Now, with regards to liver and kidney failure, antibiotics can give you that if you take too much of them. Somebody mentioned using clindamycin at 300 milligrams. 300 milligrams is actually a normal adult dose, so you can use it, but you shouldn't use it every day for the rest of your life.
Right? They were asking if you can take it every day.
None of these medicines are worth taking every day. They're meant specifically. I mean, that's what we would consider overuse, and that's what's caused a lot of antibiotic resistance. Bacterial resistance to antibiotics is an epidemic in this country. And the funny thing is that it's not mostly because of humans overusing it. It's because 80% of the antibiotics in this country are actually given to food-producing livestock, not because they happen to have an infection that needs to be treated, or not even to prevent infection. It's because statistically, if you give antibiotics to food-producing livestock, they grow faster. And for some reason, they manage to get them to market sooner. And so it is a profit-driven reason that they are giving antibiotics to our food-producing livestock, and people do perfectly fine without it. In Denmark, it's banned to use it on any food-producing livestock, and those folk are healthier than us.
We just got to thank Monsanto for all that stuff, right?
Please don't get started with Monsanto.
Okay,
don't worry, I won't, because I'll be right there with you.
Wait. Stop it. I'm not a millennial. I don't get triggered. I have issues with certain things. Millennials get triggered. I have issues with people. Monsanto's ruined this country. I really feel that high fructose corn syrup being added to all of our foods, including Coca-Cola, and I think it was 1980 or so, and our bread and everything else is causing severe epidemics of liver disease, cancer, diabetes, cardiovascular disease, and those are all interrelated from inflammation, probably because of our livers having a hard time digesting it. And thank you, Monsanto, for that.
Now, Texas is right in that.
Hold on, let them respond.
There is a comment back up at 748, Dave. Blue Healer 260. He stated, I can't get tetracycline products for cattle anymore. They took them off the market 4 months ago.
You can't get tetracycline.
You shouldn't. Okay, let me tell you about that. For a period of time, people were going around saying that, no, we're not going to be able to get any antibiotics for prepper stockpiling.
But he's talking about his cows.
That is something that is, you're right, something occurred that took away some antibiotics from the market. But they were only antibiotics that were meant for food-producing livestock.
Right.
That means that if you were trying to stockpile tetracycline for cattle, you weren't going to be able to get that anymore. But guess what? You shouldn't try to do anything other than the antibiotics that I mentioned, the ones that I just mentioned, the ones that I've written about in my articles on the website, the ones in the book. You can just go to our website at doomandbloom.net for free. You can read all about them. And the reason why is because these are meant for the ornamental fish business. Okay, we're an unusual couple in that I'm a doctor, a medical doctor. She's a nurse practitioner, but we're also people who have raised tilapia in ponds, who've raised betta all the way down to bettas in bowls. As a matter of fact, I don't know if you can see them, but those are some of our.
Don't make them fall.
Some of our
those are our awards for
prize-winning
fish.
bettas there over the years. But what basically I'm trying to say, what?
No, I was just going to say, I mean, we're talking about two different situations.
Right.
He's talking about his cows,
right,
and we're talking about ornamental fish antibiotics.
Well,
so I just want to be clear about the separation.
And pet bird antibiotics. We have parrots, a parrot too. So we have experience with these. The reason why cattle antibiotics and horse antibiotics and things like that are not something that you should be using is very simple, because they're not meant to be used at the dosages that they come in for cattle and for horses on humans. And the same thing with some other antibiotics, like dog antibiotics and things like that, are meant for animals that are 20 pounds, 30 pounds, 40 pounds, maybe 60 pounds or more, but they're dosed specifically for that. The antibiotics that I'm talking about, every single antibiotic I talk about, remember I said it has to have a criteria. It has to be only one ingredient, that's the antibiotic itself. And it has to be only produced in human dosages. The antibiotics that I write about are only produced in human dosages, even though they are theoretically for fish or for birds. Okay, so the question is, why does your parakeet need the same dose of doxycycline that a 200-pound human would need? Well, you know, how much amoxicillin does a guppy need? Does he need as much as an adult human male? I don't think so. And so that's how, when we started looking further and further and started talking to people in the pharmacy business, we found that a number of these antibiotics, the ones that we write about, indeed were just made in the same batch, just separated out, put and distributed in different bottles. Sulfadiaz. Okay, that's Silvadene. Okay, so Silvadene cream is very popular, used for bed sores, used for burns, things like that. Very, very useful. I'm squeaking. She thinks it's
your chair. No, it's your chair.
She thinks it's a chair that's squeaking, but I'm actually squeaking.
No, you're not.
My bones are squeaking.
No, you're not.
But creaking, actually, mostly. But Silvadene cream actually will last a good while. The only thing, it will not last as long as medications that are in pill or capsule form. Those medications are the ones that last the longest. I would say that lotions and creams and ointments, they lose potency faster than pills or capsules, but not as fast as liquid medicines. So you just take it from there. The bottom line with the Silvadene is that you may have to use more and more as time goes on. 5 years down the road, 3 to 5 years down the road, you're going to be using a lot more Silvadene to get the same beneficial effect than you do now with a fresh can of it, or a fresh salve of it.
Okay, so there's a question from PrepperNet, which I think might be Forrest. Can you buy, I'm assuming he's talking about EpiPens. Can you buy them cheaper if they're expired? You can't buy medication from any pharmacy that's expired. You just can't find expired. They won't sell it. Nobody's going to sell you expired medicines anywhere. If you find something that says expired, they're probably not following protocol. So they need to be very clear that it's expired if they sell it. And most of these pharmacies, they're just not going to do it. I don't know what they do in Canada or China, but they cannot do that here. Absolutely not. Another question, is it okay to store the EpiPen or insulin
in a freezer?
In a freezer.
Do not freeze.
This is a pet peeve of yours.
Do not freeze liquid medicines unless it specifically says on the bottle, freeze this medicine. Because what happens is that you wind up changing its entire chemical nature, and it may not function at all. You may lose all of the good effect of it by freezing it. Keep it cool, but do not freeze it.
Absolutely.
Good.
I just want to mention to Blue Healer, who had mentioned that he can't find tetracycline for cattle anymore. We actually did take tetracycline out of the antibiotic book while we were writing it, because Thomas Labs, which is who we usually refer people to, sometimes Fishmox, Fish Flex, sometimes a couple other stores, but there was no availability for tetracycline. So if it's not available, we weren't putting in our book, because we didn't want to give anyone a list of things and say, oh, you should buy all of these, but gee, you can't find them anywhere. So we actually pulled that chapter out of the book while we were writing it, before we published it, because you couldn't find the fish or bird equivalent to tetracycline either.
Right. But so you won't find any horse or cattle antibiotics in our books.
These are strictly
simply because they're not at the same dose
fish and bird
as they are for humans.
Fish and bird, limited a number of them.
Right. So we want to make it easy for you to understand how to use these things. So we only choose the antibiotics that are made in human dosages, even though they're not labeled for humans.
Right.
All right, so what else we got? I store in glass bottles. That's a good idea. The amber bottles, the brown bottles are actually the best ones to store in if you're going to do that. A cytokine storm. Well, you know what? I don't know how you would be able to deal with that using common household skills or resources. You're going to have to talk to Dr. MacGyver for that one.
Yeah.
There's some. I got it now. This is a good thing. I'm glad you mentioned that. There are a number of.
Wait, say it clearly because you kind of mumbled it and people might not be reading the comments.
All right.
It's from Let's Talk About Prepping.
Okay, Let's Talk About Prepping talked about how to deal with a cytokine storm.
First, explain what that is.
Okay. Okay, well, that's essentially, if we're talking about, there are different types of storms. Thyroid storm.
Yep.
Things that are really major.
Over the top.
Major medical issues. You really have to realize that there's going to be a limited amount of stuff that you're going to be able to do about that. If I keel over from a heart attack the day after the you-know-what hits the fan, you know what's happening in my body? My muscle in my heart is dying. So a portion of my heart has died. And there's not much you're going to be able to do for me. Even if you are an expert at CPR, even if you have a bag mask and you can breathe for me for a period of time, you know what? You don't have any place to take me that's going to be able to handle my medical problem, which is that part of my heart no longer functions. I
mean, there are anti-inflammatories that are herbal, but you've got to kind of figure out if those work for you. The problem with herbal medicine, and not that I think there's a lot of problems, but one of the things is it doesn't work for everyone. So if you're having problems with inflammation causing arthritis or fibromyalgia or chronic fatigue syndrome or, a whole host of other things that inflammation causes in our bodies, including cardiovascular disease, like I was talking about, you have to find out for your personal body what calms you, because what calms you might excite me. There are some people who take Benadryl and they go to sleep. It's in Tylenol PM. And there's other people who take Benadryl who are like jumpy and excited and their heart's palpitating. So people react differently to regular medicines, blood pressure medicines, diabetic medicines. We all act a little differently. Same thing with herbal medicines. Just because it says, it can do these 45 things, it might only work for 5 of those things for you. And the other things, it doesn't work for you at all. So we kind of have to get to know our bodies. And I think herbal medicine is really a personalized thing. And so you just have to kind of go through, anti-inflammatories or anti-anxieties or sleep medicines and find out which herb does work for you and make sure you store those.
Now, you know what? You should look up. I want you to look up cytokines because it's my impression that those are cells that have to do with the immune system, or not cells, but proteins that have to do with the immune system. And I'm not sure I've heard of cytokine storm. I heard of thyroid storm, but that's and that can be related.
I would just think it was an overreaction of.
I'm not sure I know what cytokine storm is. So,
I'm
just an old
immune system.
We know it's an overblow, but it's been a while since we've been in medical school, I'll tell you. But I did know that it has to do with inflammatory and your immune system.
But things like that are, as I said, are one of the many things that you are not going to be able to handle successfully in a true, hits the fan situation. And people are looking for a lot of miracles that will occur there. To be honest, if I shoot you in the chest, most likely you're going to die if there's not an ambulance and an ICU and a trauma surgery and a trauma surgeon and a trauma hospital nearby. I mean, you're going back to the 19th century in terms of where we'll be medically if something really happens. And so therefore we're going to have to accept the death rates that occurred in the 19th century for certain issues. If I shoot you in the chest, it would be the same as if I shot you in the middle of a Civil War battle, and your chances basically are 70% that you're going to die. If I shoot you in the abdomen, your chances are also about 70% that you would die, because there would be so much damage that occurs to various organs. You'd have a number of intestines that are no longer connected to each other because of the bullet, path of the bullet, that I would have to try to put you together, and probably the effort to try to put all that together would probably kill you. So these are the things that we have to realize, that there are limitations, there are hard realities associated with things going wrong. So people who are out there who are looking forward to, the end of the world as we know it, believe me, for the medic, not a bed of roses.
So cytokine storm, the reason we don't know about it is because it came out in 1993. It was mentioned about pancreatitis. And then in 1992, it was related to something else. And then in 2003, then it was related to influenza.
Well, there's no treatment for that.
It's not really specific about which disease it's related to. It's been, that term is a few different.
Cytokine storms are associated with a wide variety of infectious and non-infectious diseases.
Right.
The term was popularized. Get back.
Right. That's where I was
popularized largely in the context of avian flu. Well, guess what? If you have the avian flu, I don't care what it is that you have, your chances of dying are about 80%. So whether you die from cytokine storm or you die from other
pneumonia,
reasons, pneumonia, things like that, that's an example of something that you're not going to be able to do anything about.
Okay.
All right, let's see. One of the major threats facing preppers when the hospitals go down in a flu epidemic. Well, you know what? I will say this about us. We learned a lot during the Ebola epidemic about what we should be doing in terms of very contagious infectious disease. At that time in 2014, we had exactly 19 hospital beds in this country, in the entire country, that could handle a disease as infectious as Ebola. And when those two nurses in Dallas wound up getting infected with Ebola from when that Liberian guy made it over the ocean to Dallas, well, that opened up the eyes of a lot of folks at the CDC and the National Institutes of Health. And now many hospitals, especially the larger ones, have contingency plans to put together isolation rooms, level 4 isolation beds in the case of a bad contagious flu. Now, if it's the super flu, like you read about in Stephen King's book, The Stand, or something that is really way out there, that everybody winds up getting the disease, well, you're right. The hospitals are going to be absolutely overwhelmed. And that's why you need to have a functioning sick room in your home. Now, you don't have to have it today. I don't have to go visit your house and see an epidemic room in your home now, but you need to plan out what you would do in such a circumstance. In such a circumstance, of course, what even the government says, that you should socially distance yourself from other people that could possibly give you the disease. In community-wide outbreaks of really bad disease, if there was a community-wide outbreak, for example, of Ebola, you shouldn't be hanging around where there are a bunch of people, where there are crowds. That's one. You need to take a look at your home and find a place that is not near the common areas, not near where the family room is, where all the kids hang out, not near where you're preparing food in the kitchen. The room furthest away from that, or a hospital tent. And basically what you need to do is you furnish that room would be furnished in the most minimalist way, just work counter spaces, cots, maybe even plastic sheeting covering the cots. These are things that you would wind up having to do. And in our book, in that book there that Amy's got, Alton's Antibiotics and Infectious Disease, we tell you exactly how to put together a successful
I think Gil's good. He keeps putting it up. You're so sweet.
For epidemics. And not only do we do that, but we have a whole photographic sequence of how to properly put on and take off pandemic gear, and going all the way from head to toe in terms of face shields and gloves and double gloves and boots and coveralls, the whole 9 yards we talk about in our book.
Someone asked a question, how many antibiotics are covered in the book?
That many.
14. That's the actual chapter.
That's my next wish list item right there. I'll be getting that next month.
There we go.
So there you go. And when we, and I just want to say that when we talk about the antibiotic, we tell you not only, for example, here's metronidazole.
I'll hold it up for you.
This is just one page of the things that we talk about. These are the things on these pages. I tell you how it works to kill bacteria. I tell you, good. I tell you exactly what it treats, what the exact dosage is. And you see me going up and down, what it looks like, and side effects and all sorts of stuff. And that's just one page.
We're pretty thorough.
This particular one has even more than one page, as you can see. So we're really serious about this. Is way outside the conventional medical wisdom. You're not going to have a lot of doctors with active licenses like I have, right, and like Amy has as a nurse practitioner, telling you to do this kind of stuff. It's only because we're a member of the preparedness community, just like you folks out there, that we feel that there are going to be some people whose lives, whose deaths actually could be avoided if they just had the availability of these medications.
We do have one question from Tibor. Excuse me, it's on the screen right there in front of you. I don't know if you guys can see it.
Okay.
Wife has Graves' disease with thyroid remover. How long would she last without her daily level thyroxine? Now, Graves' disease was is a disease of overthyroid. And the treatment for it is exactly what she had, which is remove the thyroid. And so she doesn't have any thyroid hormone whatsoever. So now she's not high thyroid. She's very, very low thyroid. She doesn't have a thyroid at all. So she's not producing this stuff. She has to take this as medicine. Am I right, Tibor? Say yes if I'm right. Okay.
I'm going to say yes.
Okay. All right.
It's just, you got to take the replacement now.
So what would happen to her is not something that would happen. It's not something that would happen like to a diabetic in like 3 to 10 days, that they're going to go into ketoacidosis if they get no insulin whatsoever. If they're a class 1, like childhood, juvenile diabetic, those things can go bad, really bad, in just a few days with those folks. And believe me, I have a kid who had that, and I needed a kidney transplant and had a pancreas transplant as well. I've been through that and several surgeries with my son with regards to diabetes that was so brittle that he wound up, his body wound up crapping out when he was in his 20s. So I know that these things are issues. In your wife's situation, though, it would take a while for her to experience the long-term physical effects. And the physical effects for her is her skin's going to be very dry. She'll wind up having a very big sensitivity to cold. She'll wind up having there's just a whole series of things that happen, but these things happen over a period of time,
right?
Sometimes over years. It just depends how fast it's very individual as to how fast those things happen. But consider desiccated porcine or bovine thyroid. It may work for you, may not work for other people. It's very individual as to whether it works. Get your thyroid tested on that stuff and see if thyroid levels stay at a reasonable level on this stuff.
There was a desiccated thyroid that we ordered over the counter that came from Australia. Do you remember that?
I remember it, but I don't remember the brand. It was
50 milligrams. I don't remember the brand. I'll have to look it up. But I did order it just to see if it was real, if it would come in the mail, and it did. So
these things do exist, and the issue with natural medications is there's no standardization. Otherwise, pharmaceutical companies, believe me, they'd be all over natural medicines. The problem is that, for example, if with lavender, the strength of lavender oil or the strength of eucalyptus oil or tea tree oil, things like that, depends on a lot of individual factors. Soil conditions, the weather during the time that it grew, the time that it was harvested. Was it harvested early? Was it harvested late? There are a lot of different factors that make the effects of a lot of these natural remedies very variable. For example, aspirin. You can get aspirin by if you have a willow tree nearby. If you shave off the outer bark and you get down to the green underbark, you strip off some of a few strips of the green underbark. You can make a tea out of it. You're drinking aspirin.
Yep.
That's basically what they use. Say again?
It's the cambium layer.
There you go. Right. The green, the cambium layer is the green layer. And basically what you would have is aspirin. The problem is I can't tell you what strength of aspirin that you're taking, but still it would have the effect of aspirin. So if, let's say, if you happen to be on Coumadin or some other blood thinner, that this would probably be a blood thinner of sorts, because aspirin has a blood thinning quality that you might consider. The problem is I don't know how much you're actually giving yourself, because each tree may have a different quantity of this stuff in its underbark. So those are the problems that we have to deal with, and we have to realize that there's going to be some variation in the benefits to each individual person. But that's the way it was with our ancestors. Our ancestors worked just like that, and they would give their natural remedies to people that got sick, and the people would get better or they wouldn't get better. And so it's just hard to say, but you've got to use all the tools in the woodshed. That's why I mention all of these natural remedies. Whenever there is a natural remedy that I can fit in when I discuss a particular medical problem, you'll find it in my book. Now, let's see.
There was a question up there from Ryder Dust asking if you'll be in Colorado this year.
There's actually no longer there used to be a yearly prepper show or a preparedness show in Denver at the arena. Many years they used to have them once a year, and they no longer exists.
I found this.
Well, there it is.
Let go.
Okay. Can they see it?
Yep. From New Zealand. I was close. I said Australia. There you go.
So see, that's something that you could give it a try. Now, the dosage is not going to make any sense for someone who's taking thyroid medicine, which is usually 0.125, or there's a common dose. This says 50 milligrams.
Bovine.
Right, and it's bovine. These are basically if people aren't acquainted with fish antibiotics, this is what they look like.
Oh, it's hard to.
But
this way.
Oh yeah, I gotta get it right now. But
this way, and then the one ingredient.
And then
is
one ingredient. No, keep going.
This is the combination. That has two ingredients because it's a combo medicine, but it's supposed to be.
But both of the ingredients are the antibiotics.
Yep.
Here, this is. Can you read this? I don't know.
Yep.
Right there.
Doxycycline, 100 milligrams. There we go.
So if anybody's been given doxycycline, the dosage is 100 milligrams twice a day. And guess what?
And this is Bactrim. This is supposed to have two medicines.
All right. So Bactrim is a combination of two. This is the only exception I have is this fish sulfa forte, which is a combination of two medicines. But
that's what human is.
It is human sulfa drugs are combination medicines.
Yep.
And Bactrim and Septra, these are all. This is exactly what that is.
Got a question about tourniquets here on your screen.
Okay, tourniquets. Now, tourniquets are actually
it's down here on the bottom.
Oh, okay. Right, are tourniquets a prepper's fantasy if there's no medevac or first responders? Well, let's put it to you this way. It depends on what artery was transected. If you have an artery that was transected, you can stop the bleeding with a tourniquet if it's in an extremity, and there's a possibility that there is something called collateral circulation, that there are other areas that can take up the slack for the ruptured vessel. And it's something that happens a lot in, you know, when a amputation is done. That's what happens. Other vessels form that take over
that stump area.
That stump
Right.
area. Right.
So basically, I think what he's saying is, you know, can you use tourniquets, and is there a chance that this person's going to survive after the tourniquet?
Is there a chance?
So
Right.
I have a YouTube video that talks about the 10 principles of tourniquet use. It's a long title, but I talk about how you're going to use it, when you're going to use it, when it's appropriate to use it. And we also talk about transitioning. And I think that particular 10 critical principles of tourniquet use is actually the name. Towards the end, I talk about transitioning off. And so what you need to know is that, first of all, you shouldn't have the tourniquet on for longer than 120 minutes, so 2 hours.
Although other people, although they have been on longer without causing necessarily permanent damage.
Probably in young, healthy people. So if you got a guy who's 20 years old, maybe he can keep it on a little longer. But also those people were put into surgical suites with surgeons and oxygen and medications and antibiotics. We're talking about not having that. So I would still shoot for the 120. What you need to do is, you're not loosening and tightening and loosening and tightening. We're not doing that game. That's not helpful to you, because it may just cause further blood loss. Okay. You need to keep it on until you feel like it's been long enough, which may be a half an hour or an hour. And then you need to attempt to take it off. Now, with that attempt to take it off, you're not removing the tourniquet from its location. Okay. You're loosening it up, and then you're watching the wound. Okay. If it doesn't bleed significantly, if there's a little blood, that's okay. What you need to do is you have to put a hemostatic gauze, such as Chito-Sam, Celox, or Quick Clot, also known as combat gauze. Those are the 3 most popular. I actually don't care what you buy. They all equally stop bleeding. They're all equally proven scientifically on the field. Military carries them. Not a problem. Celox and Chito-Sam are actually divergent from the original product, which was called Celox. The 2 makers of that had a male divorce business-wise, and one of them broke off and kept the Celox name, and the other one is actually Sam, who owns Sam Medical. And if anyone knows Sam Splints, this is the guy who makes Sam products. So he makes Chito-Sam with his name, S-A-M, and the other people make Celox. Chito-Sam, if I had 3 and I had to reach my hand in and grab just one, I probably would grab Chito-Sam. Don't tell the makers of the other folks. But Chito-Sam is crazy cool. They somehow wove the Chito-San, which is the product, into almost like a blanket material, like a soft, almost like a baby blanket, but kind of thick.
Softer than the other 2.
It's soft, and let me tell you, packing wise, I would rather pack that in a wound. It's really going to fill up. It's pure product.
Easier to pack.
It's not impregnated on gauze. It is the product. Somehow they wove it, they spun it, they made almost like a material. Really great for packing. So you're going to loosen the tourniquet. If you don't see a whole bunch of blood come out, you're going to pack with the hemostatic gauze if you've not done it prior. It wasn't part of your initial, I'm putting my tourniquet on, I'm putting the hemostatic gauze on, and I'm covering it with an Israeli bandage. If you haven't done that,
this is called converting a tourniquet.
Yes. Transition. And this is part of military steps.
You'll find this in the TC3, which is the trauma guidelines basically for the military. You'll find what she's saying pretty much in the order.
Step by step.
In the order she's saying.
So again, check the tourniquet. If you have minimal bleeding or no bleeding, go ahead and put the hemostatic gauze in. The gauzes that I mentioned can all be in place for 24 hours. So you don't have to pull that gauze out 5 minutes later either. So you want to get the tourniquet off, put the hemostatic gauze in. You want to, if there's more space, which if you use the Chitosam, there won't be. If you use the quick clot combat gauze, that's more of a, it almost looks like a regular gauze. It just has the product in it. That's not real thick and doesn't fill up a lot of space. So you may have to put another gauze on top of it, packing it. Always pack towards where the blood was coming out. So if it came here, you want to pack towards this way, towards the heart.
Closer to the
Closer
torso,
to the heart.
Probably where it's bleeding. Yeah.
Heart or torso.
Mm-hmm.
Same thing.
Right.
And then you want to, once you filled up the wound with extra gauze, packing it hard, you're going to put a pressure dressing on, Israeli pressure dressing. We actually just filled, we have 28 minutes that I have to chop up in different Israeli bandage videos, but we just did how to put one on a neck wound, two different spots on the head, an arm, how to self-apply, and I forget what else. Anyway, a few different wounds, and I know how to stabilize the leg with splints. Okay, so I've got to chop that up, but we do have that video. So loosen the tourniquet, pack it with the hemostatic gauze, fill it up with regular gauze of any sorts, sterile preferred, cover it up with the Israeli bandage, and then just leave the tourniquet in place for a little bit longer. If you don't see any other bleeding, you can take the tourniquet off. That you want to get the tourniquet off, but you can't take that off unless you're sure the bleeding has stopped. Now, you're not going to loosen the tourniquet 5 minutes after you put it on. You're not going to look at it like you're baking a cake and you keep opening the oven, okay? Because then the cake is not going to bake. You have to leave the tourniquet in place. If you're a plumber, you shut the water off while you repair it, okay? So you're trying to shut off the blood while it gets repaired, which means your body forms a blood clot. Your body's really good at stopping bleeding. And they say all bleeding stops eventually, one way or another. Well, but you want to stop it when the blood is still in the body.
Now, the thing that the question, the word medevac came up in the question, and I just want you to know is that everything that we have just told you is what would happen in a military situation. And then what would happen is a helicopter would come and it would evacuate, TACEVAC or medevac,
well, that's not what I just told them.
The casualty.
I told them to pack it and leave it on for 24 hours.
Right. Well, right.
And then after that, you're going to remove all of that. If you want me to keep going, then you're going to have to clean it really well. We all do wound cleaning at some point, but you want to make sure the bleeding is stopped. Bleeding stop is first. Then there's cleaning the wound. That comes next. You clean that wound really well. You can use drinkable or potable water from any source. As long as you have made the water drinkable, you can use it for wound flushing. That's something people don't realize. They think they have to store fancy liquids or, normal saline. Forget that. Don't store these liquids. First of all, if you got to bug out or leave your house, they are way too heavy to carry, let alone if you're carrying drinking water. Now you got to carry something to flush wounds. Forget it. You just use the water that you're going to use for drinking, or find a water source
that's clean enough to drink.
If nobody's getting sick from that water with whatever you've done, boiling, aqua tabs, Berkey filter, whatever it is that you've done that's made the water not make everyone have diarrhea or vomit or have, sickness, you can use that water to flush wounds. You're going to flush that wound, clean it really, really well, and then you're going to pack it with sterile gauze. You want to change your dressing twice a day. You can use some raw honey in that wound, which I hope everyone is storing if they're a prepper. Raw honey is great to help prevent infection. It is perfect for healing. It's also wonderful for burns. So if you want to go past the medevac, these are the things that you're going to need to do.
All right. Now, having said that.
You actually let me talk.
Yeah. Having said that, that is what would happen. What would happen is, in the best case scenario, is you would do this. You would be really good and strict about keeping that wound clean. And over the course of time, the circulation, if it will be sort of.
Hold on. You don't need to boil the honey for open wounds. Do not, because that destroys the properties of it.
But what I'm saying is that there's a chance that that wound will become infected in any situation because of the type of wound it was. It may have been incurred in a very dirty situation. That would not be a surprise. It could be that a bone was shattered as a result of whatever, maybe a gunshot or something else that also caused the bleeding.
There might be complicating factors
There
that
are
make this much worse.
There are a lot of complicating factors. And so you have to realize
maybe there's still a bullet inside.
Despite all of this,
right?
Despite all of this, there is a death rate associated with even doing things perfectly right. And so this is the type of thing that you have to understand. In some circumstances, you would go to amputation with something like this.
And so definitely some antibiotics.
And antibiotics.
I'm not saying this particular one. It's just the one I picked
now,
up.
Amputation, that's a crazy word to tell
okay, let's
people.
not talk about amputations right now. I just have to answer a couple questions here.
Okay, but one thing I'll say is that I have a video on some principles of amputation. I have an article on it on the website. It's also in our main book, the Survival Medicine Handbook. So it's something that you have to realize. Again, you have some limitations.
Absolutely.
Okay, and just before she gets too close into it here, if you look down here, and let me get my mouse over to that screen. Look down here, you see their phone number. And you also see their YouTube channel, Twitter, Facebook, Pinterest, and the other ones. They are also on iTunes.
Yeah. Well, actually, you know what? The best place to look for those little icons is at the top of doomandbloom.net. They're bigger icons and they're more obvious, and they have the podcast and they're easier to click on. So doomandbloom.net, not the store, but just doomandbloom.net has those icons right at the top. Yeah, the Pinterest, it has the Twitter, the YouTube channel. You just click on the little YouTube icon for that. And those little icons will take you everywhere. And then we have over 1,000 articles. But yeah, let's talk about prepping. You shouldn't cook it. There's enzymes in there. It should not be cooked. Honey, raw honey. Now, hospitals do irradiate their honey to kill possible, not all honey has it, but possible botulism spores. So they do that one thing, but they don't cook it. They still use raw honey in their burn units and in their wounds. So it's being used in hospitals. So it's proven. It works really well.
A quick little insert here, going back on the on their YouTube channel, on the trauma care supplies and demos playlist. There's the amputation injuries in off-grid scenarios video right there. How to apply tourniquets and all the other fun stuff there that we've just been talking about.
Yep. We try to, do how-to videos. Like I said, we do demonstrations. I have a video that's kind of old, but if you don't really understand all of the different gauzes out there, the roller gauze and the ABDs and the multi-traumas and what's the sterile and what does 4x4 mean. And I have a video that's kind of ancient on there called Survival Medicine Gauze. I think it's about a 15-minute video, but I literally go through every kind of gauze I can possibly think of and show it to you and explain what the label is, why it says what it says, and when you would use that particular one. And why do you need all of these different kinds of gauzes? Why do you need a roller gauze and a 4x4? So I explain all of that and kind of break it down into layman's terms of why you need all of these different gauzes. It's not just about Band-Aids. You're going to have wounds if we have long-term situations. So you're going to need different kinds of gauzes for different reasons.
Yeah, after watching that video, I actually increased the amount of different gauzes I have here in the house. I now have virtually everything.
Oh,
I do want to bring up one question.
And they're cheap, which is what I love.
There's one thing that I've seen contested, and seeing as how I have you two captured here and you are my prisoners. The old version of Celox, the powder stuff. I've heard many doctors say not to use that due to the fact that it is very difficult to get out of the wound. Is that true?
You're talking about.
So I'm the Celox tourniquet person here. So Celox has one product now. I'm not sure if they still have small packets of granules. They used to have a bigger packet. I'm not sure if they still produce that now. Okay, they keep changing their products.
Recently.
Okay, well, they might still have it. Celox is not a problem to wash out. The reason Celox is not a problem to wash out is because if you actually opened it, which of course I've opened many of these different products just to see what they look like and use them and demonstrate them. Celox, when wet, either with blood or with water, turns to almost looks like gelatin. So imagine you've opened a packet of Jell-O. It looks like that. It has the consistency of Jell-O, the more water or blood it comes into contact with. And what that means is when it's washed out, it comes out very easy, super easy. So Celox granules are flushed out quite easily.
What he's talking about.
Well, I'm going to go to that other one. So Combat Gauze or Quick Clot used to also come in a powder. And then at one point they put the powder into like a gauze packet. And what happened with that one is it didn't get wet and gooey and like Jell-O. It got dry.
Yeah, crumbly.
And it got cakey. We'll call it cakey. So imagine a cake mix that's just sort of or flour. If before you put a lot of liquid in it, it's really rough and stiff, and it just was difficult to get out. So they don't make that anymore. So if you find any Quick Clot powders, they're ancient and they're not being produced anymore. And that's on purpose because they didn't want to have this issue. There's also old versions of Quick Clot, and those used to burn. They had problems. So the new generation of Celox and Quick Clot are completely different. They're different items now. They're apples and oranges. They have the same name, but buy the new stuff. I think they've all been out for at least 4 or 5 years. They don't make those other ones anymore. So they don't burn. They're not hard to get out. Quick Clot is now only in gauze. And guess what you have to do to gauze? You just pull it out. And if you happen to use the granules and not the gauze on Quick Clot, you just flush it out. So none of these are going to be an issue. They're not going to burn, and they're not going to cause further damage.
I just want to say thanks to Tibor and Lori Jean. We appreciate it.
Yeah, don't mind me. I have to search the medical kits. I got a little teeny one. I got a medium one. I got that big one back there.
Looks good.
Awesome.
I still want your big one. I just don't know how I'm going to get that one yet.
Yeah,
the only thing I don't have in my personal kits right now is a dental instrument kit. I've got a surgeon's kit in that bag. I do know a doctor locally. I don't know him really well, but I've discussed with him in the past about, if grid goes down, which he thinks I'm cuckoo, but I said, if grid goes down and you don't have access to your surgical equipment, I do have a pack we can barter for something. Because he does have horses, he does have a farm. So, maybe I can barter my way into a horse for me and my kid.
Now, I just want to say that dental issues are issues for people that believe that there's a chance that there may be a long-term event. I mean, if you have a few days without power because of a storm, you probably don't need a big dental kit. However, a dental kit is, if you really believe that there is some event that may occur that may take you off the grid for a significant period of time, over the course of time, you're going to, if you're going to be the medic for the group, you're going to run into people with dental issues. And there's nothing that affects the work efficiency of survival group members than having a really bad toothache. If you've ever had to go to work with a toothache, you know that the only thing you can think about is getting that.
I had one bother me today.
Out. Yeah.
And I've never had a cavity. So I was like, what is that?
Well, I drove
from an eye on it.
So
from Grand Rapids, Michigan to Dallas, Fort Worth, Texas with an abscess. My face swelled up the side.
Well, yeah, that can get really big.
Dang. Well, so what we did is we actually gave a bag to 2 different dentists, and we said, you're off the grid for the next 10 years. You're the dentist. Fill it up.
Right.
And so the funny thing is that they actually put together almost exactly the same stuff. And their kits were almost exactly alike. And so we put that together. And so we actually have a dental kit that we think is the best that you'll find anywhere around.
And it matches where there is no dentist.
Yeah, and it matches
which tells you
what
how
the
to use it.
recommendations also that in where there is no dentist.
I'm sorry for anyone that's had toothaches.
Yeah, that's terrible.
Toothaches, tooth problems. He has a lot of tooth problems, although not lately. Thank goodness. Knock on wood. Knock on fake wood, I think.
I read in places that during the Vietnam War that for when sick call came around, that the medics had to deal with dental issues as often as they had to deal with medical issues. So if it's a long-term event, those dental supplies are going to be more and more and more important as time goes on.
You go to that link I just posted, that's the store. Everything we've discussed tonight as far as combat gauze, dental kits, their bags, the books, everything you'll find on that link right there.
Thank
and
you.
yes, I'm promoting it. Please go buy.
No, you're sweet. You,
Right,
you don't have to. We're just here to help. We're hanging out with friends. Everyone that we've
well, you
seen
know what? I'll tell you right now.
friend,
If one of these books saves one life or helps somebody save a life, then getting you guys over here tonight, which is a blessing for us, will have made my efforts tonight worth it.
Oh, you're so sweet.
Well,
Thank you.
It just helps one person.
We appreciate it, guys.
Aw. Love. Hugs and kisses. Wait, hugs and kisses.
I have no idea. I don't. That's all young.
Remember, that was our emojis before. Remember, we did zeros and X's for hugs and kisses.
I never did that. I'm too old.
That's all. Oh, okay. Well, you're a guy. That was my whole emoji thing. Was X's and O's. Now they have fancy little things.
X and O's, guys.
Yeah.
I remember writing that on letters to my mom when I was away, and
hugs and kisses.
Hugs and kisses, Mom.
There you go. See, you were a good boy.
Don't tell people that. That's my reputation.
Oh my gosh, I agree. Let's talk about prepping.
Yeah.
Heard people have been shot and given birth, and tooth pain is worse.
When you have an abscess and your face is swelled up the size of a football, yeah, you can't concentrate.
I've heard.
And I got to tell you, without antibiotics, a tooth abscess is a could be a life-threatening event. As a matter of fact, I read somewhere that they found the mummy of the Egyptian queen Nefertiti, and they found a big old hole in her jaw. They think that she actually died because a tooth abscess just ate away at her and just killed her that way. Yeah.
Yeah, because even still, the abscess itself, if you try popping it manually, it'll get in your bloodstream.
Yeah,
yes,
exactly. No,
exactly
that's
right.
Scary.
So it's
everybody floss tonight.
Another good reason to have antibiotics.
Brush twice a day and floss. Yeah. Drink lots of milk.
And garlic. Texan talks about garlic. Garlic indeed is another one of those properties like honey.
Yeah,
has a lot of antibacterial action, and there's actually hard data that goes behind that.
You know what I did growing up? I have no idea if this helped me and why I've never had a cavity, but we used to brush our teeth with, we dip our toothbrush in the hydrogen peroxide and then dip it in baking soda. And my dad never had a cavity. My brother had a few. My mother had a few, so it was probably genetic for him. But I never had a cavity. But that's how we brushed our teeth. Hydrogen peroxide and baking soda. So I don't know. Maybe it'll help.
Well, the bottom line is that's what you're probably should be using. Should be having some baking soda in your preps, because the toothpaste is gonna run out eventually. So that's what you're gonna be using.
Yep.
Quick question from myself here.
Yeah.
Where they mentioned about garlic. Now I heard that garlic in a wound is toxic. Garlic juice. I
don't see a lot of information about putting that in wounds, and so in and of itself, I would not recommend doing that. I think
I worry about garlic rotting
itself,
like rotting, like garlic. If you just sit garlic out, like it rots. But you know what? The raw honey, and support your local beekeeper.
Garlic
somebody, yeah, eat the garlic.
Ingest it.
But somebody was talking about getting it straight from the hive, which is awesome. You guys are super lucky. But support your local beekeepers and get your raw honey from somebody local. They need our help. We got bee problems. Hives die. It's just horrible and sad.
Well, another thing too about getting your honey from your local beekeeper, and it's not mentioned very often, but it does get mentioned, is if you get it from your local beekeeper, you're
Alex.
getting back the nutrients and stuff from the area where you live already.
That's true. That's true.
And
You're
the bacteria that they deal with, the
Yep.
bacteria you're dealing with.
Yep.
Right.
So
And
that
also,
honey neutralizes it so much faster than if you get it, say, from California and you live in New York.
you're right. But also, if you have problems with allergies, they say that because the bees get all the pollen from all of the things that are flowering, that you actually almost get like a little bit of a dose. Like an allergist can give you shots to help with allergies. And then what they do is they give you little doses of it and you get desensitized, like you just said. And the same thing may happen with the raw honey because the bees are collecting from all of this pollen that may be causing you allergies, but then you take a little bit of that honey, you may have less problems with allergies. So there's a lot of reasons to use raw honey in many various things.
All right, let's talk about prepping. That makes read his stuff. He's making some good points about baking soda for dental health, and I agree with everything he's saying there.
And there's one other thing I'll add to that. What he's saying is, if you ingest something that you feel may become poisonous, and you guys, I'm sure, will back this up, drink charcoal.
Yes.
Charcoal.
Yes, the thing with charcoal, it's very, very good with regards to, we have a 20-pound bag of it, as a matter of fact. So it's a aquarium supply as well. And we think that it would be very, very good if you have anything that might be a poison. Certainly give that a shot. The one thing you need to know about it, though, it binds you. So you may not go for a while if you ingest it. So only do it when you need.
Go where? I'm just kidding. I'm kidding. That's a joke.
Where are you?
I'm pretending to be a dizzy blonde, which I'm not.
You're not. You're not that at all.
No, actually, every time my local Walmart decides to get rid of the stock that's getting close to expiration date, they'll put it in a big bin right there by the cash register. They'll mark it all at 99 cents, and I try to pick up 5, 6, 7 packs.
There you go.
The diarrhea, all that kind of stuff that people don't usually think of. And I've got like half a tub full of that stuff.
Awesome. Can never have enough. You can only run out of room, which is the problem. When all the kids left for college and whatnot, I now use space under their beds. I removed all of the stuff from one of the rooms. I have shelves to the ceiling, those Home Depot shelves. I have one room that's got high ceilings, and I mean, like, I don't know, there's 18, 16 feet high ceilings. I have like 3 of those Home Depot things stacked up to the ceiling filled with stuff. You got to use your space under beds and behind clothes. Yeah,
you can't move back in, kids. Sorry.
Nope, they can't. We can't move because we're stuck. I got.
All right, so how...
Anybody else have any questions out there?
Have we run out? Oh my goodness.
I'm not going to tell you out loud, but I think you guys passed your hour.
I know.
Oh, okay.
I know. It's past my bedtime.
Well, we appreciate you having us on.
Well, it's been a pleasure having you guys here. We greatly appreciate it.
Thank you. We appreciate it. It was fun. No, we love this. I have no idea how you do it. I would appreciate a tutorial in the future, the next few days, maybe.
Not a problem. Send me an email when you're ready. I'll set us up a private session.
Tell me about this website we're on and how you hooked it up to Facebook and YouTube, because we'd like to do this. We love to talk to people.
Have you guys on as guests.
Yeah.
Well, like I say, whenever you're ready, just send me an email and I'll walk you through it.
Oh, that would be lovely. Thank you so much. I really appreciate it.
Just so you know, there's 2 different versions. There's the free version, which gives you up to 20 hours a month, which I'm on. And Dave is on the paid version, which you do a whole bunch more fancy things like throwing up that background. But I'm probably going to wind up on the paid version here shortly because I'm burning through my free hours. I do my own lives.
You're going to get in trouble.
No, they just cut you off and you either got to buy. Oh, yeah. See, now you're in my bunker.
So he's changing the background. Like we're in a bunker now.
Yeah, there you go.
I love it. Where's our MREs?
Last question. What do you do for a rattlesnake bite? Basically, one thing I want to say is that snake bite kits are actually no longer recommended for any of your camping or survival kits. The truth of the matter is that they only would get out a tiny percentage of the venom, and you almost have to have them in your hand as the moment that you're being bitten,
Right.
because your circulation just gets all that venom into the circulation pretty fast.
Right. Anyone who's ever had stitches,
Just wash the area with soap and water if you can.
Wait 1 second. Just talking about how quickly the venom absorbs. If you, this is Joe and I, this is how we talk.
Yeah.
If you got stitches, or let's say you needed a little xylocaine, you can imagine that it takes hardly any time at all to be numb. It's the same thing with the snake bite. The second you get bitten, your capillaries are starting to absorb that and move it through vessels and veins and throughout your whole body. So it's not just sitting there waiting for you to use a snake bite kit. It's already moving and going and leaving.
Well, real quick, basically what you do if you can't get to somewhere where they have anti-venom, what you need to do is you need to have that person rest, keep that person calm, put the injured extremity, usually the bite will be on an extremity lower than the level of the heart, and basically, in most cases, interestingly enough, 30% of rattlesnake bites, pit viper bites, are non-venomous. Maybe they had injected it into a rat, a couple hours ago, or maybe they just didn't get deep enough into you to inject the venom. So 30% non-venomous. If it is venomous, that area will start to burn, and it'll start to burn pretty darn fast. So you'll know. Also, don't forget that venomous snake bites. If you don't see the snake, the venomous snakes are going to have two larger bites, two larger holes, and a couple of little holes for their back teeth. But the fangs, and a non-venomous snake bite is going to have a pretty general, uniform looking bite. The head of a pit viper is triangular, so that's another way that you can tell a snake that is venomous. Of course, there are coral snakes in the U.S. You see those bites much less often. They're very similar to the king snake, which is non-venomous. The difference is the color, the bands of red, black, and yellow. So it goes, I think, red touches black, venom it lacks. Red touches yellow, kill a fellow. So if you take a look at pictures of king snakes and coral snakes, you can tell the venomous one from the non-venomous one by that little thing I just mentioned.
Okay, no tourniquets.
And no tourniquet. What?
And
Don't use a tourniquet.
Oh, no, do not use a tourniquet.
Do not tighten anything around it.
You're going to concentrate the venom in that area.
If you can have the person not move, that's the best thing. If you have to leave, do it slowly. You need to keep the person calm. Don't increase the heart rate. Don't freak them out and go, oh my God, you just got bitten. You're going to die. Right.
Well, unless you really don't like that person after all.
Right. Boo.
And usually deaths from rattlesnake bites occur maybe in very old folks or very, very young kids, but a healthy adult human very rarely will wind up succumbing to those kind of bites.
Right. And you're not supposed to cut it, right?
No.
No cutting, no sucking, no tourniquet.
Yep.
Stay calm.
Yeah. Just on that note, my dad, when he was 8 years old, stepped off the porch of the house down in Indio, California, and got bit just below the knee by a rattlesnake.
No.
The venom made him sick, but the horse serum they gave him to stop it nearly killed him.
Wow.
Oh my goodness.
That's where you get it from, horses.
Yeah.
That's terrible. Very
so he turned out he was allergic to the horse serum, but not the venom. The venom just made him kind of sick.
How about that? Isn't that something?
He would have been better off without it.
He probably got more of a dose.
Terrible, poor
dose
thing.
of it from the anti-venom than from the snake itself. Well, but he made it.
Yeah, I'm here.
All right, there you go.
Yay.
I'm just going to say this one more time, folks, and especially those of you who watch this on replay. Make sure you go check out their webpage. Go join their Facebook groups. Make sure you give them a like. Watch a couple videos. Their videos are very informative. Like I said, I watched hers on the different types of gauze, and I now have more gauze, and I know what to do with. It's because of some of their videos. my son last year I got him a bike to ride, and while I was in there cooking dinner, he decided to stick his finger in between the sprocket and the chain while he was pedaling. And because of some of the videos, I knew exactly how to wrap it. So it would keep the pressure on it, stop the bleeding until we could get him up to see a doctor and have a doctor look at it.
How is he now?
After 10 days, there was nothing. He was completely healed up in 10 days.
All right.
Good.
So I give glory to God for that.
Thank
Okay,
God.
I just threw up their YouTube channel and the doomandbloom.net links there for everybody, so you can check those out.
Thank you so much. Well, I appreciate it.
Yep. Awesome. And let's talk about prepping. Yes. Keep the person calm and isolate.
Yeah. And leg below the level of the heart.
Yep. We have articles.
And
Their whole article.
We have articles on it.
And videos on it.
Print them out. Everything can be printed. Pretty much the entire book's on our website, just so people know. It's just that it would cost you more to use ink and paper to print them than just about. That's the only reason we made the book. Honest to goodness, people were printing stuff out that we were writing, and they're like, "Can you please write a book?" And we hadn't even thought of it. We looked at each other. We're like, "Write a book? What are they talking about?" But they said it's cheaper. I'm like, okay. So like a year later, we did the first book, and then I don't know. 2 years later, we did the second book, and 3 years after that, we did the next book. I'm like, honey, my head's going to explode. But we put everything on website, so we want everyone to have the information.
Did you guys catch that last question right there for Let's Talk?
Let's see. Why no restriction if elevation is meant to isolate? You're not elevating, you're lowering.
No, the reason is you don't want
lower than the level of the heart. Don't elevate.
Exactly.
yeah, I think the restriction you mentioned before, because it consolidates the venom in that area. If the venom is spread out, it's not as concentrated, and your body can deal with it better.
That's a good. That's a good explanation, I think.
All right. I guess we're going to say goodnight.
All right. I guess that's it.
I think my eyes just rolled up in my head. I'm like, it's 11 o'clock.
Well, we appreciate your having us
It has been
on.
wonderful. Thank you.
Thank everybody
Again,
for being.
You have blessed us. We thank you very much.
Right.
Well, we're very honored to have been on, and hopefully you'll have us on again one day.
Anytime, you're more than welcome.
All right. Thanks so much.
Bye, guys.
Good night,
Thank you
everybody.
so much.
No problem. Thank you.
All right. Dave, are we going to stick around and do longer?
Sure.
Okay,
See you
so
guys-
you guys
down
down
there.
below there where it says exit.
Okay, I
right
got it.
Yeah.
All right.
All right, and thanks again for the tutorial. And
Take care.
thank
Good
you,
night,
everybody.
Lori Jean,
who-
Tibor, Texan. Let's talk.
Gary Stone, right?
and everybody.
So everybody,
Okay.
we really appreciate it. Bye, guys.
Bye now.
Have a good night.
Okay, really cool couple. They argue like my wife and I do.
All right. Now that we got the medical stuff done, let's talk about the stuff, the elephant in the room here, folks. Those who are just here. Don't worry, Ontario. It'll be up for replay too. Virginia just declared a state of emergency. And I don't know if West Virginia prepared mine still got hers going.
I'm going to check here. Give me a second.
If she is, we may just go ahead and go over there. But if not, she had Virginia Prepper on tonight while we were live here, which is why she didn't show up and he couldn't. So it was done in order to.
They are still alive.
Well, I think we ought to just jump over there because that would be easier to catch up on some of that information.
All right, give me a second and I'll throw their link in the chat. Okay, so there is West Virginia Prepper Prepared Mind.
So if you guys get a chance, just run over and tell her I sent you over, and let's go raid her party. And let's catch up on the information. That way I'm not giving bad information by accident.
All righty then.
I've only got a partial list. So
Okay.
I thank everybody for showing up tonight. Y'all be safe. God bless. If you're just getting in, check out the replay. And let's talk. I mentioned it back in 1st of December when I made my hour-long video. This was stuff that was going to happen. All right, let's go over and bug her. Good night, all. Be safe. God bless.
Come on. Why is it acting up here? All right. Let me go ahead and stop sharing. And all right.